Assalamu alaikum dear doctors. In this video I am discussing about the cystic fibrosis history discussion. So first, what are the complaints can be present in cystic fibrosis? So the main complaints are failure to weight gain, cough and fever and shortness of breath and acute exacerbation. So these are the present history is complaint plus systemic review. If failure to thrive, analysis of the complaint and nutritional history. So when failure to thrive, what are the history will ask? When it started, how long he is suffering, is there anything make it what worse and anything make it better, is it preceded by any illness like disease or weaning, type of feeding, breast or artificial or weaned, amount, special food, any defect in his mouth, palate or lips, do you have any food diary, measurements, what about his head size, what about the parents height and weight, does he look like you and his daddy, does he have any chronic illness, any other concern, FWASL activity. So FWASL, we know that fever, any weight loss, any activity, how his activity, sleep is affected or not. These are we ask. Now, if the chief complaint is cough, that the child has cough sudden, analysis of the complaints and respiratory history. So we ask when the cough started, how long he is suffering this cough, is there anything that is make it worse or anything make it better, is it first time or recurrent occur, when was the last time, dry or productive in nature of the cough, color, amount, triggered, cold, pollens and animals, timing of the cough, is it more at night, is it related to exercise, is there any shortness of breathing or cessation, if infant then apnea we ask, any musical sound, any cyanosis, does he have any chronic illness, any other concern. FWSL activity, that any fever, weight loss, activity, sleep is affected or not. From chest, systemic review, chest, what question you ask, any chest pain, breathing problems, cough, park, snoring sound, nasal polyps, itchy nose, and if it's seasonal, recurrent earbugs, if chronic, ask about the previous sputum, contact to COVID patient. Then GIT, you ask the tummy pain, tummy size, poo nature, it is loose or constipation, difficult to flush, any mouth ulcer, soreness of the back passages area, swelling from the back passage, thrown up or spitting, any yellowish discolorations, any mass, especially in the right side. Then CVS is asked about that awareness of the any heartbeats, chest pain, how many pillows, any sweating during feeding, level of activity or recent tiredness and fainting attacks. From CNS, we'll ask that signs of increased intracranial pressure, abnormal movements, fits, abnormal behavior, any concern regarding his visions, hearing or speech, and itchy eye. Urinary system, we ask what about his pee amount and color, blood pressure, recurrent bugs in pee system. MSQ will ask that skin spots, discoloration or pigments, joint pain, joint swelling, bone ache, anybody lumps, hair, nail changes, itching or scratch marks, ask if follow with physiotherapist. Endocrine, we ask that tolerance of cold or heat, any one measure his blood glucose level. Hematology, we ask that recurrent bugs, pallor, cyanosis, neck or anybody swelling. Past history, we ask about the 5T IOA, that is the any treatment is ongoing on, previous any trauma, any traveling history and any transfusion history and any investigation previous, when it is started, when diagnosed, any admission previous or not. These are any surgical history we'll ask. Then when diagnosed, how he was diagnosed, by whom, what was done for him, history of any hospital admissions in normal ward or ICU, which medication given to him, if on tobramycin, ask if level was done for it, complication of the treatment, crayon, side effects, last sputum culture, team stuck to his medications and follow up visits, history of operations, recent travel. Parental history, prenatal history will ask like in details, maternal disease or drug during pregnancy, any screening done during pregnancy, type of delivery, term or preterm, fast cry, birth weight, time of passage of fast poo, time of separation of the belly button, heel prick test, yellowish discoloration after birth and admission to the NICU. So details, we take the prenatal history. Development, we ask very important in details and growth chart. Puberty history, I ask that delayed puberty, key in previous exam scenario. Vaccination, we ask that receive all his shot, any extra shots, pneumococcal, influenza and varicella, parents receive the COVID vaccination. And family and impact, we ask any similar condition, it is an autosomal recessive conditions, asthma or atopy, any psychological issue on child, sibling and parents, easy access to hospital, any social or financial support, we'll ask. Allergy, will ask about the allergy to food, cow's milk protein intolerance, to drugs, atopic march, allergic rhinitis and conjunctivitis. Home, we ask that aeration, animals or pets, smoking at home, washing bed sheets at which degree, and any illness, any disease, any concern, any nearby constructions is going on, new points or garden, new paints or garden. So these are we ask. And so school, we ask the type of school, school performance and attendance. So differential diagnosis, the answer will become of failure to thrive of cough. So it can be like cystic fibrosis previously diagnosed patient, exacerbation occurs. It can be cystic fibrosis associated with diabetes mellitus. This time any disease newly developed. So this is all about. Thank you.